Hi, Dr. Martin. This is one of a edition of our Walk with a Doc and Walk with a Future Doc virtual walk. Welcome, everyone. We have a great featured doc and future doc today to talk to us a little bit about vaccines and wellness visits and why it's important to kind of still get out there and do that. So without further ado, I'm going to introduce our medical student, Carly Waddell. She's a fourth-year medical student here at UAMS, and I'm going to let her introduce herself. Tell us a little bit about what brought you to Walk with a Doc, what your passions are, and then we're going to have you introduce our feature doc when you're ready.
Perfect. So hello, everyone. My name's Carly Waddell, as she said. I'm a fourth-year medical student at UAMS. And this fall, I'll be applying for residency in pediatrics. So an important part of pediatrics is preventative medicine, which is part of the reason I'm excited to go into it. So just vaccines, being able to prevent diseases for lots of history that we know about, and protect not only my patients, but the community I'll be a part of is really important to me. So that's just a little bit about me and what brought me here today. And so to tell you more about that will be Dr. Patil.
Hello, everybody. Thank you for this opportunity. My name is Sowmya Patil, and I'm an associate professor of pediatrics at the University of Arkansas for Medical Sciences and practice at Arkansas Children's Hospital. I'm also into medical education. I teach a second-year medical school for their clinical skills course. There's a practice of medicine course. And being a pediatrician, vaccines are like bread and butter to us. And so this is my job every day, and I'm a big pro-vaccine person. So when Dr. Martin asked me about if I could be a feature doc, I was like, yes, it's vaccines, and I'll get on board with you. And so here I am.
Thank you, Dr. Patil, for coming on today. So to get started, I know we're in a pandemic. This is part of the reason why we're doing virtual walks now, as opposed to being all together doing a walk. For this UAMS chapter, one of the things that we wanted to kind of emphasize is August is National Immunization Month. And so my first question for you is, we're in a pandemic now. Why is it still important for people to come out, get their vaccines, and to attend their wellness visits?
Yes, thank you for that question. And that's a very relevant, timely, and most important questions, because I can remember when the pandemic started in March, and then the guidelines came out for a lockdown. Everybody was so scared. They locked down, they were all in their houses, and we saw a steady decrease in the number of children coming to their well child visits and to get their vaccines in our clinics. And I can understand parents were scared, and parents want the best for their children, and they were scared of getting COVID, so they were all at home. But I would like to reinforce and emphasize that yes, we are in a pandemic, but because we are in a pandemic, the other diseases don't take a time out. They don't say, you know what, it's COVID here and I'm not going to be here. They don't do that. And so vaccines, as we all know, is the most scientifically proven, the most greatest invention, I can say, to prevent these, dangerous diseases in children. And so I would definitely encourage everybody and say, though there is COVID can be mild in children, and COVID may not be as severe as in adults, but all these other diseases that are dangerous can still affect your children and may be very severe if they fall sick with that. And so to prevent them, please bring your children, please take your children to your PCPs and get their vaccines at whatever age they are in a timely manner, because the other diseases can cause severe effects and severe long-term effects in our children if we don't vaccinate them right now.
Excellent. What sort of preventative measures is your clinic doing so that parents feel safe when they come to the doctor to have their vaccines or their wellness visit?
Absolutely. I think not only our clinic, but every clinic around the country, not only our state, we are following all the CDC and the local Department of Health guidelines. We are making sure that every patient and their parent is screened at the entry with temperature checks and a screener, and only then they're allowed inside, even our waiting rooms. We have separated our waiting rooms into a well child waiting room and a sick child waiting room, which means that anybody who comes for their well child checkups will not be interacting with the sick child who's also there, and they will be separated, and they'll be taken back into the room immediately to start their visit, as well as give their vaccines. As well as we have strict guidelines that everybody should be masked, whether it's a parent, a patient, a nurse, a tech, a doctor. Everybody is wearing a mask. It's mandatory, so that we can keep each other safe. Also, the hospital has provided extra PPE, what we call personal protection equipment, for all the doctors and the nurses and the hospital staff, so that we are properly geared to take care of our patients and keep them safe. So we are following all the regulations from CDC and the Department of Health, and I can assure all the parents that it is very safe to bring them to the hospital, to our clinics, and get their health supervisions done, and well child checks done, and get their vaccines.
So one of my other questions is, with the idea that we're potentially looking at a vaccine for COVID-19, there is kind of a reemergence of a lot of the myths about vaccines and people being hesitant about vaccines. What sort of myths do you hear about vaccines, and what do you tell your parents and patients to try to get them to come in to get their vaccines?
And this is a very valid question, because we talk about this with our parents every day in our clinic. There are many myths, because there is so much of information explosion out there, the media, social media, friends and blogs and Facebook pages and all of those kind of areas where they get a lot of information. And because of this information, how they interpret it or how they analyze the data out there is very different with different parents. So first of all, I would say, when the parents come and we say your child needs this vaccine, if there is a resistance, or when there is a resistance, I would first kind of put a plug that we need to be very calm. We can't get defensive, not judgmental, and kind of listen to them and see what their concerns are or where they're coming from. The common myths that the parents usually say are, I don't want so many vaccines at one time. It's going to overwhelm my child's body, and it's not going to work. Well, I can say that it's scientifically proven that you can get as many vaccines as the child is due for at the same time, and it does not overwhelm the system, and all of them act or produce the immune response appropriately, even when given together. And we all know about the autism and the vaccine battle all the time. And so that is another big myth, that, vaccines cause autism. We know that that has been debunked. We have had multiple papers and studies out there which has shown that there is nothing in our vaccines that can cause autism. So I would like to reassure the parents that vaccines is not one of the cause of autism. And there are many other myths, and I can go listing. I don't know how many you want me to talk about, but the other myths were the additives in the vaccine, like the mercury and the thimerosal. Most of our vaccines do not contain mercury or do not contain a thimerosal, which causes harmful effects. So I can assure you that vaccines are very safe. They are the safest thing that you can give your child to protect from dangerous diseases. So if you have any concern, I would encourage you to talk to your PCP. Please talk about your concern, because no parent should be scared of giving a vaccine. So talking about the concerns, the misconceptions, the myths is very important with the PCP, and I'm sure your PCP will help you make the right informed decision. And so vaccines are safe. All the whatever everybody's hearing is a myth. I can tell you that.
Is there a place that people could go for reliable information about vaccines?
So there are multiple websites which are reliable. And I would say CDC website for vaccine, the American Academy of Pediatrics, also www.immunize.org. These are very good resources about any questions of vaccines, like how they are made, how much, what is the dose, what is it linked to, any adverse effects, contraindications, how many doses, when they need to be given, all those kind of questions. They are very well described on all these websites. If you say CDC vaccines, it takes you to the vaccine page, or www.immunize.org. So they're all good websites.
And last question is, so it sounds like vaccines and wellness visits are a good way of promoting self-care. And so what sort of you, Dr. Patil and Carly, doing for wellness and self-care during this pandemic, and what things would you want to tell people out there to continue to do?
I would say, first of all, take care of yourselves well so that you can take care of everybody else. We are in this together. We are in the same storm, but we could be in a different boat in the storm. So because we're in the same storm, we have to all work with this together. And so the key is everybody wear your masks. Anywhere you go, if you're less than 6 feet or for more than 15 minutes with anybody talking, even to your friend, just because they're your close friend does not mean they cannot get COVID. So, they might be exposed. So always wear your mask, wash your hands. Washing hands, sanitizing hands is very important, and maintaining social distancing for 6 feet wherever you go, to grocery store or, to any park or playground with your children or anywhere. Please maintain that distance. Also, self-care is important, like exercise, eat healthy, the most common things, like always find time to exercise and eat healthy so that you can be stronger and be more resistant to all these diseases. And so self-care would be eating right and exercising for sure. Yeah.
What about with you, Carly? What sort of things are you doing during this pandemic to take
I've been
care of
doing the same sort of things, just being aware that even if I'm being careful, I don't know where the people around me have been. And so I just have to be very careful wearing my mask, using my hand sanitizer, washing my hands. And then I have tried to just go outside, biking, walking, pretty much whatever I can to get some fresh air. So I know it's hard in the summer, but even just a short walk seems to really boost my mental health. So I think that's been really important. And then just staying connected with people, even though I can't see them. So being able to do Zoom, FaceTime calls, things like that, I think has also really helped my mental health during this. And I'm sure it helps others. So.
Yeah, I think the point Carly is making is very good, that mental health, we always think about physical health, but mental health has become so important during this pandemic. So, I would encourage everybody to, take care of the mental health by, if you want to do yoga, meditation, mindfulness, all those are very important as well. Also, social distancing does not mean social isolation. So please talk to your loved ones, talk to your friends. Zoom, the technology has exploded now, so Zooming or calling, texting each other. And so it's very important to keep in touch with your loved ones more now than ever before. So please maintain that social interaction and don't get isolated to help your mental health for sure.
I think those are great tips. So again, thank you all for being with us for this edition of Virtual Walk with a Doc and Future Doc. So I encourage everyone to get out there, bring your mask, but it's pretty safe to go outside and walk with your family, walk with your friends, but maintain that social distance. All right, thank you. Bye.
Thank you.
My family and my dog, and I just want to tell you to stay fit and just walk on a daily average, everyone, and Hey guys, walking is important. So if you want to walk with a friend, just wear a mask. And if you're walking around someone, just wear a mask. Also, you can walk with your family or your pets or dogs.
Hey, welcome to the walk with the dog. And you can also walk with your dog. Yep. And it's great to walk every day. It's good for your body. It's good for your bones, your muscles. It's good to prevent falls. It's also good for your brain. As blood flows to your brain, it makes you feel really good. If you're at home and you can only walk with a walker or a cane, walk in your backyard, walk in the house, but you must walk. Welcome to Walk and Rock with the Jerry Dog.